States across the country, they've lifted pandemic restrictions. People feel like they're getting back to normal. Meantime, the medical community is watching for this new Omicron subvariant, BA2. The CDC says it accounts for some 35% of new COVID cases, though the nation's only averaging about 27,000 cases of COVID per week across the entire country. And experts say a new wave is highly unlikely. Here's Kelsey with more.
Well, Adrienne, with the new COVID variant surging across the world, people are now wondering, will we have to shelter in place again? Well, a University of Chicago study is gaining a lot of attention. It researched whether or not shelter in place mandates actually worked. Do they really minimize COVID cases and deaths? And how did it affect us economically? The results are eye-opening. Non-essential businesses closed. Much of the American workforce stuck at home. That's what the nation looked like as 43 states issued stay-at-home orders between March and April of 2020. Previous studies have claimed these shelter-in-place orders saved thousands of lives. But one group of researchers at the University of Chicago put this theory to the test.
Really what we wanted to find out is whether these shelter-in-place orders were making a difference in terms of reducing the spread of the disease and deaths from the disease, and also whether they were making a difference on the cost side in terms of reducing economic activity.
Turns out, Americans aren't good rule followers. In fact, smartphone location data shows we only decreased our movements, on average, by less than 1% during the stay-at-home mandates.
There was one group of people who were already changing their behavior, already sheltering in place, without any need for an order from the government to do so. There's a second group of people who were not going to change their behavior no matter what.
The new study says the mandates had no detectable effect on either COVID cases or COVID deaths, and only small effects on the economy.
There were absolutely business closures and reductions in business that took place during the pandemic. And what we were trying to ask is whether shelter-in-place orders contributed to that. So while we didn't find great health benefits, we didn't really find large economic costs either.
With the new BA2 COVID variant on the rise, Professor Berry says we need to learn from the research and adapt.
I think we may be at a point in the pandemic where we want to focus more on protecting the most vulnerable among us, rather than trying to change the behavior of the society writ large.
And Professor Berry also says while the mandates didn't appear to have a huge impact on the first wave of the virus, we can still take what we learned from the study and apply it today.
Thank you so much for watching. Make sure to click on the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.